Do you know what oppositional defiant disorder is? It's a fascinating topic that deserves our attention. Today we're going to delve into this subject, unmasking the facts and debunking the myths. Oppositional defiant disorder, often abbreviated as ODD, is a behavioral condition that typically begins in childhood. This disorder is characterized by a pattern of angry or irritable mood, defiant behavior, and vindictiveness. It's not just the occasional tantrum or rebelliousness that all children exhibit at times. ODD is a more severe, persistent issue that can significantly disrupt a child's life and relationships. The symptoms of ODD can be quite varied. They may include frequent temper tantrums, excessive arguing with adults, active defiance and refusal to comply with adult requests or rules, deliberate attempts to annoy or upset people, blaming others for mistakes or misbehavior, being easily annoyed by others, frequent anger and resentment, spiteful or vindictive behavior, and difficulties with authority figures. Of course, not all children who display these behaviors have ODD. However, if you notice a persistent pattern, it could be a sign of this disorder. So, what causes oppositional defiant disorder? The exact cause remains unknown, but it's likely a combination of genetic, biological, and environmental factors. Some research indicates that children with certain temperaments or who have been exposed to specific environmental stresses, such as inconsistent parenting or family instability, may be more prone to developing ODD. Now let's talk about treatment options. If you suspect a child may have ODD, it's crucial to seek professional help. A mental health professional can conduct an evaluation to determine whether the child is dealing with ODD or another condition. Treatment for ODD typically involves therapeutic interventions, such as cognitive behavioral therapy, family therapy, and social skills training. In some cases, medication may also be used, particularly if the child is dealing with another condition, such as attention deficit hyperactivity disorder or anxiety. To wrap things up, oppositional defiant disorder is a behavioral condition that often begins in childhood. It's characterized by a pattern of angry or irritable mood, defiant behavior, and vindictiveness. The exact cause remains unknown, but it's likely a combination of genetic, biological, and environmental factors. Treatment typically involves therapeutic interventions and, in some cases, medication. Understanding ODD is crucial, not just for parents, but for anyone interacting with children. By understanding this disorder, we can better support and guide children who are dealing with it, helping them to lead happier, more fulfilling lives. Remember, mental health is as important as physical health, and we should always take it seriously. Well, that wraps up our discussion on oppositional defiant disorder. It's been a pleasure sharing this information with you. Until next time, keep exploring and learning.